Parents do what they do because they're doing what they think is best. And our role is to sort of just guide them and support parents because it's pretty tough with little kids. It's tough enough just raising children full stop. You add on a potentially life-threatening illness and it's amazing what parents are able to cope with. Credit to all of them.
Welcome to our special ITP in Kids series, part of the Beyond the Count podcast. This series is dedicated to children living with immune thrombocytopenia and the families who support them. We'll be exploring everything from diagnosis and treatment to school, sports and emotional well-being. We'll speak with leading ITP clinicians, hear from parents who've walked this path, and even chat with kids themselves, giving you a full 360-degree view of what life with ITP really looks like. Whether your child has just been diagnosed with ITP or you've been managing ITP for a while, this series is here to support you, inform you, and empower you every single step of the way. Today, I'm joined by Associate Professor Dr. Chris Barnes, Paediatric Haematologist at the Royal Children's Hospital in Melbourne and long-time medical advisor to ITP Australia and New Zealand. Chris helps us unpack how ITP presents in toddlers, what signs to watch for, and how to balance safety with letting kids be kids. If you're feeling anxious or unsure, you're not alone. This episode offers clarity and expert guidance to help you navigate those early months with confidence and care. Let's get started. We have the Associate Professor, Dr. Chris Barnes, with us on Beyond the Count. Thank you so much, Chris, for joining us this episode.
Very nice to be here.
Wonderful, wonderful. Now, Chris is from the Royal Children's Hospital in Melbourne and has been part of our medical advisory board for an extremely long time, since day one. So thank you so much for that, Chris. And you actually participated as well at our patient conference back in 2019. Yep. So you're a foundation. You're a foundation piece of the organisation. So thank you for all of the work that you do for our ITP community.
It's a pleasure. It's really, ITP Australia is a very important organisation, Danielle. I don't have to tell you that. It has the perspective of patients very much at the centre of everything it does, and it's a really big help to us in the clinical space.
Thank you so much. That's wonderful to hear because we do need to work collaboratively.
That's it.
Now, we are doing this kids series, Kids and ITP, and I brought you on today to talk about the littlest members of our ITP community, our little toddlers, who we know that can have their own challenges in learning to walk and all those sorts of bits and pieces while they're still developing, yet, surprise, here's this ITP diagnosis. How is ITP different in toddlers compared to, say, older kids?
Well, I suppose ITP is different in the paediatric population compared to adults to begin with. And so before looking specifically at toddlers, it's worthwhile mentioning that in general, there are differences between paediatric ITP and adult ITP. So with paediatric ITP, generally, the prognosis is really very good. But obviously there is a small proportion of patients in the paediatric space that do have chronic, really problematic ITP. It is, fortunately, it's relatively uncommon to have really severe ITP in children, although it can be a major problem. Adult patients, however, the risk of it being more severe and chronic is significantly higher. So as a paediatric group, the patients are different. Still very common, still potentially life-threatening, however, and it has a significant impact on families. And all of that is intensified or even more significant when you're dealing with a toddler. And as you highlighted, toddlers are prone to risk-taking behaviour. That's what they're meant to do. They're meant to find out where the boundaries are of personal safety, and hopefully that's done within a family environment to be able to provide that support. But toddlers are going to crawl on things. They're going to even jump off things. They're going to really put themselves at risk. And that's when episodes of bleeding can be significant in the setting of a patient with a very low platelet count. So a toddler with ITP is a real stress for a family, and managing toddlers can be really challenging in this space.
Yeah, and it is challenging as well. You know, they're taking their first steps, or as you said, they're jumping off things that they probably shouldn't be doing, because they're trying to understand those limitations or that risk factor when it comes, and they have no fear. Let's be honest there, a vast majority of them have no fear at all. And so, you know, the poor parents sitting there on the sidelines, their anxiety, really does skyrocket. And while you don't necessarily want to wrap kids in cotton wool or bubble wrap, you do need to protect them just a little bit. So from terms of being a toddler, what should parents really watch out for in terms of things like bleeding, bruising, maybe head knocks as well?
So these are discussions that parents should have with their treating paediatric haematologist or paediatrician who's comfortable looking after ITP. And you've highlighted the importance of getting a balance between wrapping a child up in cotton wool and driving that toddler crazy, and indeed everyone crazy, versus, common sense things around avoiding as much as possible times when the young toddler may be putting themselves at risk. Like, some toddlers, as we all know, are climbers. That's just a thing that they do. So it's something that a parent might just need to be aware of to try and reduce the risk. But these discussions really take a bit of time in the clinic space. It should be done in the setting of reassurance, and that can be challenging when you're talking with parents of a patient who has got a very low platelet count. But generally, these kids are going to be okay long term. So it has to be done in the setting of a supportive, optimistic environment to say it's going to be okay, but here's some common things that you need to be aware of. So at one end of the spectrum, if a toddler, heavens forbid, falls and falls on concrete and has an episode of loss of consciousness, that's very straightforward. That patient needs to come to hospital urgently, and this is with regard to head knocks. At the other end of the spectrum, if you've got a toddler who's going through their normal course of events during the day and bumps their head on a table, maybe has a little bit of a cry, which would be typical, they're much more challenging to manage. But generally in the clinic that I work in, it's reassurance. It's really it's unlikely the patient is going to get any significant intracranial bleeding from a very minor head knock. And then anywhere along that spectrum can be really difficult to advise. But if at all worried, I think the parents need to liaise with their paediatric haematologist or their paediatrician and develop that sense of trust. And unfortunately, it is a little bit iterative, so that the parents can understand that this end of the spectrum is the severe end of the spectrum is something that needs to be acted on. The less severe, not so. And that just takes time. It's challenging to give any absolute benchmarks of within that middle range of what needs to and what happen or not happen, because we want to make sure that we're providing enough reassurance to the parents to say this is going to be okay. And hopefully, as I said at the introduction, the platelet count will improve and this isn't going to be a long-term issue. But if it is a long-term issue, then very close relationship and liaison with the paediatric haematology team is important, and something that we spend a lot of time in clinic reassuring families that minor head knocks generally are not associated with anything severe, and their toddler will be okay. The parents sometimes need to be, I'm joking here, but the parents almost need to be resuscitated when they come in with a head knock, because they, it's very stressful. This is stressful. And I think parents need to be kind to themselves in this space when they're confronted with a baby or a toddler with ITP. It's really challenging stuff, but lean on the clinical team to get that advice.
And the other thing too, I think that you've already touched on too, is that if little Johnny or little Jenny is a bleeder or not a bleeder, regardless of their platelet count as well, will also determine the action that you'll take or that the parents will take. If they have a good sized bruise or egg on their head from a head knock, that's obviously going to help determine the action as well.
Exactly right. And Australia's a very big country, and if you're getting that head knock in outback Queensland or Western Australia, it's slightly different to metropolitan Melbourne, for instance. Just the accessibility to care is something that at the centre that I work in, we probably take for granted a little bit. So it is something that, even though I'm sort of somewhat flippantly saying engage with the haematology team, as you've highlighted, that's really important. But it's not always easy for patients who live in remote or regional Australia.
And that's probably one of the things too, is having these discussions well before any of these sorts of things happen, to say, okay, so what is my course of action? If I need to reach you or if I need emergency assistance, what do I do? And having those conversations before anything happens, really early on in the diagnosis. So there is somewhat of a path to like, what should I do here and what should I do there, and how do I reach out to you? Because if, like you said, if you're in regional, rural or remote locations here in Australia, you may need to do a telehealth call or, so on and so forth. So these are the sorts of things, to be prepared is one of the big elements of this as well, I suppose.
And that's where the organisation, our organisation, the ITP Australia, can really hopefully reach some of the patients who don't have such ready access to care, to say this is what I don't see why a patient in remote or regional Australia should be in any way disadvantaged just because of the distance. So these are the benchmarks that I think are important, that are highlighted within the community, within the ITP community.
And that health equity is so important, so amazingly important. I was only on the phone and messaging a mum, only a couple of weeks ago on I think it was Saturday night, and because her child had a head knock, and she didn't know what to do. So, I talked her through it, and it was Mum. Mum was, really anxious and really stressed and really concerned, which is completely understandable. Absolutely understandable. So it's important.
Yeah, it is important. So that's another real credit to ITP Australia to be highlighting some of these challenges and hopefully giving parents some direction of what happens when there's a head knock, or indeed, if it doesn't have to be a head knock, it can be God heavens forbid, a broken arm in ITP. Kids are on monkey bars, and it's a very common scenario to fracture a wrist falling off the monkey bars. What do you do in that space? And hopefully having that direct line into the haematology team can result in pretty effective and appropriate therapy. I might highlight, that whilst ITP on one level can be relatively simply managed within a specialised environment, some of our medical colleagues, particularly some of the general practitioners, and this is not a criticism at all, because I think the general practitioners in Australia do an amazing job with having to understand so many different pathologies. If they're confronted with trauma in a patient who's got a platelet count that's very low, but is not a bleeder, as doesn't have the phenotype or the pattern of bleeding, it might be that they don't need any treatment. So I think that connection with the specialised care is pretty important, and hopefully can support the patients.
And that's right, with GPs and even with some paediatricians as well. They can't be expected to know absolutely everything.
It's not fair.
ITP is a rare disease, so it's not extremely common that every GP will see ITP. So having that location and the reason why we have the website and, people like yourselves on our medical advisory board, if somebody needs to reach out for information and updated information, that's where you guys definitely come on board, because you can't be expected to know absolutely everything.
No, that's fair, very fair. And, we're all we're all online. And so the reassurance that you can get through reputable, reassuring information, I think is another credit to ITP Australia.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
Okay, so this is one of the really, really big and most common questions that we get from patients all the time. Can toddlers still go to daycare and to playgroups? I know the answer to this one.
Yeah. You go for it, Danielle. From you would know this because you'll be connected with so many different patients.
Yes, you can. Yes, definitely.
Absolutely.
You'll know your child. You'll know if they're well, the signs and the symptoms. You'll know your child really, really well. And having so we have an information sheet where you can actually hand that over to daycare or playgroups to say, this is little Johnny. You put a little photo of your child, your toddler on the card to say, okay, he or she has ITP and this is what it is and this is the clinician's information. This is my contact information. So if any of these sorts of things happen, you know how to contact us to then inform these people as well that are looking after our kids. What do you say to that?
I agree with all of the above. So kids spend lots of time at daycare or, indeed school. Or it's a really important part of their socialisation procedural. They're developing those skills, and let's face it, the kids develop amazing memories, and there's some real benefits to going to daycare. Maybe some of the coughs and colds that circulate around daycare in the middle of winter is a little bit of a disadvantage, obviously, but that's just a fact of life. And the staff at the staff at daycare centres are very engaged, very caring. And by giving them the information that you're providing, you can facilitate real engagement of the staff into ITP. You're educating them, you're providing a level of reassurance and trust between the carer and the parent. And so if it's done, again, it takes a bit of time and effort on behalf of the parents, but it is something that they can control and organise a time with the daycare staff to say this is all about ITP and reassure them. My experience, having been around for a little while at least, is that in 2025, daycare and kinder and playgroups, they're going to be on the phone in a heartbeat if something untoward was to happen. They're within a certain insurance category, and so I suppose the bottom line is the daycare staff will call you. Our approach is hopefully by fostering a bit of trust and a bit of understanding that they don't go over the top with, getting back to that comment of putting a child in cotton wool. They don't go over the top, and it's about getting the benefits of accessing other kids and socialising and, indeed giving parents an opportunity to go to work, because that's a real pragmatic element of living in 2025 with most parents working, at least both parents working part-time at least. It's important. Daycare is a really important element of the family that we can support. So I agree with everything that you've said, and if parents can spend a bit of time with the daycare staff, my experience suggests that it can be a really positive and engaging discussion to let them know that, the toddler is going to be okay. It's okay. You can just need some additional care framework.
You touched on it there earlier, talking about daycares and, the winter season, colds and flus and, picking up all the bits and pieces, as they do at daycare. I know my kids did when they were in daycare. And same with my grandson. He's now in daycare and he's now picking up everything and bringing it home. That's also helping to build their immunity and their immune system as well. So more often than not, some kids will see a drop in platelet count, but if they're not a bleeder, you've got that sort of a bit of a balance there. But what would you say to parents that their child is sick and constantly sick at daycare? What would you tell them?
Those periods of constant illness generally, obviously with some exceptions, are generally short-lived. There's the kids just sort of pass bug on to bug, and then it's only over a period of, it might be weeks, it may extend out to months. My advice is hang in there. It's okay. The kids are as you said, it's probably a normal part of developing an immune system, getting exposed to these bugs. So there's a positive potential benefit. If a patient is having significant bleeding, so the mucosal bleeding, the blood noses, this is a toddler, the wet purpura, those blood blisters in the mouth, etc. If they're falling into that pattern of ITP, then they probably do, you consider talking to the haematology team about what the options are in terms of increasing the platelet count for a while, or to support them going to daycare. That's certainly a discussion that I've had. But you've articulated very well. If a patient is getting coughs and colds and they don't have any of those bleeding symptoms, then it's reassurance. They're going to be okay. Unfortunately, the coughs and colds do circulate. Hopefully it's short-lived, and you just got to weigh up the risks and benefits. And the benefits of daycare are not insignificant from a practical point of view, going to work for the parents, for the socialization aspect of the kids. And importantly, we don't want, my advice to parents is you don't necessarily want children to be singled out or treated incredibly different just because of the ITP. If your perspective is not to send your child to daycare, that's fine. But I think it's worthwhile checking, are you doing this just because of the ITP, or is this your approach full stop? And hopefully we can get the parents just to see that the ITP can be managed, and through the haematology teams around Australia, of which there are some exceptional haematologists. We're fortunate in Australia to have really good quality medical teams to guide them with this decision. It's not easy. Coughs and colds can be, don't need to tell you, they can drag the family down when it's just a constant being unwell for weeks on end. It can be tough.
I know. It can be very tough. It can be absolutely tough. And I was once told before, it was a couple of years ago now, and these coughs and colds and this sickness, they may rock the boat when it comes to the platelet count, but it's unlikely to capsize the boat. So there's a bit of juggling that needs to happen, but the boat will hopefully eventually stable. And if the child doesn't automatically go into some sort of remission, or the immune system no longer starts attacking platelets.
That's right. Yeah. Hopefully, as we mentioned at the beginning, ITP in pediatrics generally gets better. And so we just get the parents to hang in there and not cause lots of morbidity, or what we call morbidity, I'm not saying overreact or underreact. That's a very judgy term. It's, parents do what they do because they're doing what they think is best. And our role is to sort of just guide them and support parents, because it's pretty tough for little kids. This is tough. It's tough enough just raising children, full stop. You add on a potentially life-threatening illness, and it's amazing what parents are able to cope with. Credit to all of them.
Yeah, no, I think it's when you do come out the other side and things do start to settle. Because you've known me for a long time, I've had ITP now for more than a decade, and where I was as a patient 10 years ago compared to today, vastly different scenarios. So from a parent's perspective, I can completely understand. But when you look back, or when those children then do look back as adults on that experience, it's a blip.
Yeah, that's it.
Definitely a blip for them. So, know that that's, that it is part of this roller coaster that you're on at the moment. But we are with you, throwing our hands up in the air with you, right alongside you on that roller coaster. Know that you're not alone.
Well put.
We've all got tickets. We're all there.
No, it's well put. And there is, parents come into the clinic room, and if we're able to, the benefits of being able to talk to other patients with ITP and the patient organisation shouldn't really be underestimated. We in the medical, or we in the clinical space, I think probably just because we tend to be a little bit time poor, I think sometimes we don't necessarily, not that we don't value, we're not exposed to the value of patient organisations as much as we should. It's incredibly, we can't walk around in the shoes of a parent who's got a toddler with ITP, but a parent can talk to someone who's had that very experience. Amazing. It can be really very therapeutic and reassuring. We should do more of it.
It is, and it can be so life-changing as well. I know that at our patient conferences, you get that collective drop of the shoulders, I'm in a safe space, these people actually know what I'm going through kind of sort of feeling in the room. So, when you physically meet, online is fantastic, and, and the community is quite small considering. But when you're physically in the room together with somebody else face to face who just understands and gets it, it's pretty momonumental. It's the sort of stuff that difference. if I could bottle it, I'm sure I could make millions. But that's a whole nother podcast. I think there's definitely a whole nother podcast. Now, before, when we were talking about daycare, you touched on looking at options to increasing platelet counts. So one thing that we haven't necessarily touched on in this episode is, treatments versus the watch and wait treatment protocols, especially in children and not necessarily done in adults. Did you want to elaborate a little bit on that?
So our practice generally is informed by guidelines. The guidelines, just very briefly without dragging down the conversation about the detailed guidelines that are available, but just at very high level, the treatment in children is generally active observation. So it's actively observing a patient until they get better. Now, that's the general consensus in paediatric ITP, is it will get better, and generally patients do not need treatment, but there is very good treatment available. So there's the acute ITP with the steroids and IVIG, which I'm sure your patients are very familiar with. That has each have got benefits and each have got side effects. Then you've got the thrombopoietin agonists, which Dr. has recently come onto the market. We can use in pediatric ITP, for example. And then you've got some of the immune modulation, which we won't necessarily go into, and indeed splenectomy. So that's the range of treatment that we've got available. But again, highlight, pediatric ITP, it's active observation and generally gets better. If, however, and you've mentioned it a couple of times, a patient has a particularly a phenotype or a pattern that's associated with significant bleeding, then it's important, I think, at least in the clinic that I work in, to at least raise the possibility of augmenting the platelet count with any of those three areas. So acute, the thrombopoietin agonist, or the immune modulation. And that's what patients or parents should have that discussion with their treatment team about. If a patient's actively bleeding, so blood noses, mucosal bleeding, for instance, then they're the options that we've got available in Australia. And fortunately, we've got really good treatment available. Now, they've all got risks and they've all got side effects, so they have to be discussed in that space. But they're the discussions that you should be having with the haematology team.
And the good thing too is that we have all of that information on our website as well. So including the guidelines, we have a copy of the guidelines on our website available for free, as well as treatment information sheets for each of the different paediatric options specific to paediatrics. So we have an adult range, but now we also have the paediatric range as well. So you can actually physically take these either in with you, or healthcare professionals also use them as well when discussing different treatment options as well, to give parents or patients the opportunity to discuss, is this going to align with quality of life, the current bleeding, do I need to increase the platelet count, is my child needs to have a surgery, or so on and so forth as well. So there's all these little bits and pieces that sort of come along the way, but having all of that information available on the website as well is also really helpful for both yourselves, healthcare professionals, but also for parents to have a read up on and go, okay, so if we do have to go down that path, you can already be prepared to have some of those discussions, or even just have that knowledge, knowing where that is so you can pull it out of the drawer if and when you actually get to that point.
No, it's great. And the information is all there, as you've highlighted. It's to get that we call medical literacy, which is a fairly formal term, but some of these topics are pretty complicated. So having it in that format for patients, is invaluable. It really is. So we direct the patients to that information. It's very important.
Yeah, no, we do get a lot of downloads, and we do get a lot of parents downloading and having grabbing a copy of that via social media, or jumping on the website directly as well. Now, I've got one more question before we wrap things up. When should parents worry about their child, and when should they relax just a little bit? And we've sort of touched on the answer of this already a little bit, but in your experience, when should parents worry? When should they relax?
So each doctor, each clinician, each healthcare professional, each nurse will develop their own narrative around how they communicate to parents, and it very much depends on that patient-centered care. So we need to sort of target the information to the patient. But at very high level, and this is my narrative, it's not particularly evidence-based, but there's 3 times that I think parents need to, alert the healthcare professional. So new mucosal bleeding. So what that gets translated, that's blood noses and wet purpur, or the blood blisters in the mouth. If that's new, then I'd be contacting your haematology team. The second is trauma. So we've touched on if there's a head knock, and hopefully we've provided some guidance, although it's really pretty challenging to provide absolute firm benchmarks with that. So any trauma, you really need to contact your haematology team. And then the third, which is less relevant for toddlers, but maybe slightly older kids, is any incidents where there's a headache that's a little bit out of proportion or doesn't settle with simple analgesia. I think it's worthwhile touching base with your haematology team, because the risk, whilst really small, and I don't want to overstate this at all, the risk of it bleeding in the brain is incredibly uncommon in pediatrics, but it does happen. So I think it's important for us to present it within the framework of uncommon, but it does happen. So, and one of the symptoms that can be presenting is a headache that doesn't settle with just simple analgesia. Contact your team. So they're the three items that I try and encourage patients to take on board. That's when you need to contact the haematology team. In terms of when to relax, be kind to yourself. I think parents need to be very kind, and this is a bit of a stressful time. It's already stressful, as I've said. So relax when you can. And it's easy for me to say, not looking after a little toddler with ITP, but it will get better. Hopefully you connect with your haematology team and they'll guide you through this journey. And at the end of it, I dare say, and I'm not sure if it's appropriate, but the resilience that you develop as a family and a child getting through this is really something to be admired. This is tough, but it is something that does get better. Generally, not always.
That's so amazingly well put and rounded. Thank you so much, Chris. The one thing I would probably finish with is that if you're really anxious and you're, as a parent, if you're really anxious and you're really worried, it's better to find out and ask the question than not.
That's it. There's no, parents say, I'm a worried parent. They provide that. But I try and say, you're not actually a worried parent. You're a normal parent.
You're just a parent.
Yeah, that's it. Just normal. And what we need to do in the clinic space is provide some reassurance that it's absolutely 100% okay to ask any question. And hopefully you've got that relationship with the haematology team, and generally the haematology teams around Australia are exceptional, amazing quality of doctors and nursing and other allied health staff. So take advantage of it, talk to them, and as you said, Danielle, find out the information. Don't be sitting there being worried about things.
Yeah, there's no point to, because you will just spiral, absolutely spiral.
Very much so.
Yeah, no. And here's my one challenge to parents. Do something for yourself and be kind to yourself.
Be kind.
Just do one thing for yourself. I think it's really important. You got to look after the carers as well, our parents, our partners, our support people as well.
Nicely put.
Well, Chris, I think we have wrapped that up so beautifully. Thank you so much for joining us on Beyond the Count. I've had an absolute ball catching up with you.
Likewise.
And
likewise.
Here's to a couple new episodes in 2026 as well that we've already started planning. So thank you so much for joining me, and we'll talk to you soon.
Thanks, Danielle. Lovely.
I hope you all got a lot out of today's episode. Before we wrap up, here are 4 key takeaways from our episode with Dr. Chris Barnes. Number 1, toddlers with ITP present unique challenges. Their natural risk-taking behaviour and developmental stages make managing ITP more complex. It's important to balance safety with letting kids explore and grow. Number 2, most toddlers with ITP will recover. In many cases, treatment isn't needed unless there is significant bleeding and the immune system is still developing, and for most children, ITP is likely to resolve on its own. Number 3, head knocks and minor injuries are common. Parents should work closely with their haematology team to understand when to take action and when to breathe. Building trust with your care team helps guide many of these decisions. Number 4, daycare and socialising are encouraged. With the right communication and safety planning, toddlers with ITP can still enjoy playgroups and daycare. These experiences are important for development and connection. And lastly, please visit itpanz.org.au for more information on many of the resources and free downloads we've actually mentioned in this episode. A huge thank you to Chris for joining us on Beyond the Count. We're thankful that you've made time to join us on this episode and all the work you've done and continue to do to support the ITP community, including children and their families. If you're looking for support, connection or information, visit itpanz.org.au. You'll find The Count, our quarterly magazine, patient stories, treatment information sheets, clinical guidelines and a wide range of resources designed to help you and your family feel informed and supported. Most importantly, you'll know that you're not alone. There's a whole community here just waiting for you. If this episode was helpful, please share it with others in the ITP community and leave us a review on your podcast platform. It helps more people find Beyond the Count. We've got more expert conversations, patient stories and more coming soon. So hit the follow or subscribe button to stay updated. Thanks for listening as we go beyond the count together.